Hi, it's Dr. Garza here today. I'm in day 2 of my new practice in McKinney. Girls to Women and Young Men's Health and Wellness is now open at the McKinney location. And, my goal this week is to really help people understand what we do in our practice. Each day I'm going to be in front of another fun piece of art. So today, this is in one of the exam rooms, and I just love this picture of this Dalmatian with rainbow spots getting blown off of it. It's fun and inviting and makes me smile. So today I would like to highlight how our practice addresses women's health type issues. Many times we have patients coming in before they start puberty with lots of questions. And so we'll see young patients starting at age 10 that really want to know what's normal, what to expect, kind of the estimated timeline of things to develop. And, so much of the work I do is in education and in guidance and what we call anticipatory guidance, which is really the bread and butter of pediatrics and working with children. So we talk to patients before puberty. We talk to them about puberty being a process. It's not an overnight affair. And obviously patients' bodies go through changes gradually, and kind of really going over with them what to expect in those changes. And then once patients start their periods, we will often see patients to talk about ways to manage their periods, even some like hygiene issues or how to use a tampon, just kind of things that may be hard for their parents to go over with them, or they just need some more guidance in. And we also see many patients for period-related problems. I talk about that term a lot, but what that means is it's somebody that's having just irregular symptoms related to their period. Maybe they're having severe cramping, and that is interfering with their ability to play volleyball. Or maybe they're having heavy bleeding where they're leaking through and having to change a pad every 2 hours. Maybe they're having nausea, bloating, that's interfering their ability to get to school. Or also the irregularity, bleeding too often, too much, and then, potentially irregularity where patients go several months without having a period. So, we want to talk to patients about when that is normal, what to expect, when, things are kind of in that normal range versus when it could be a sign of a problem where we need to evaluate that patient with lab work. We might evaluate that patient with the sonogram. We also talk about treatment. Much of the treatment we do related to period-related problems involves hormones. And, we talk about that course of treatment and options with families so that they really understand how these medicines can help them, what to expect, kind of the course of treatment, and really helping them feel better and get back to the activities that they want to be involved in: school, sports, dance, and just, life in general. And then as we have our older patients, we'll often talk about sexual health as it relates to women's health. We want to make sure women are protected against pregnancy when that's relevant. And then we do a lot of direct discussion about prevention of sexually transmitted infections and through screening for sexually transmitted infections. And so, we are following standard guidelines for screening all teens and young 20s for gonorrhea and chlamydia. We do, of course, pap smear screening starting at age 21. That's a little bit later. But also, patients will maybe not realize they're having an infection, and we find that on screening. And so we treat and we follow up, and we do lots of guidance and education about prevention. So that's something that comes up related to women's health. And then the other piece are just vaginal complaints. And so patients may have vaginal itching, infection, irritation, And so, every day I'm talking to girls about this and looking at, is this a possible infection? Not an STD, but, one that comes from their own body's kind of imbalance, whether it's a yeast infection or a bacterial infection. We're wanting to rule out vaginitis. And then we also talk about, just hygiene issues that can affect vaginal health. So that is something that comes up very frequently in my office with young girls and teen girls and, those in their 20s that we take care of as well. So that was just a quick overview of women's health in adolescent medicine at our practice, and I hope that helps you better understand the type of work we do. Have a great rest of your day.